Menopause is a natural biological process that marks the end of a woman's reproductive years. It's typically occurring between the ages of 45 and 55. To truly understand its pathophysiology, we need to explore how the delicate balance between hormones begins to shift over time. From puberty onward, the ovaries contain a finite number of follicles that mature and release eggs during each menstrual cycle. As women age, these follicles gradually diminish in both number and quality, leading to what we call ovarian follicle depletion. This decline is the central event that triggers the cascade of hormonal changes seen in menopause. As the ovarian reserve decreases, the ovaries produce less estrogen and progesterone, the two hormones responsible for regulating the menstrual cycle. The hypothalamus, which acts as the body's hormonal control center, senses the drop in estrogen and responds by stimulating the pituitary gland to release more follicle-stimulating hormone FSH and luteinizing hormone LH. Normally, these hormones would signal the ovaries to produce more estrogen and trigger ovulation. However, because the ovarian follicles have become less responsive, this feedback loop fails. As a result, estrogen levels stay low while FSH and LH levels rise, a classic hormonal signature of menopause. To make this easier to remember, you can use the simple mnemonic lower. L. Loss of ovarian follicles. O. Ovarian unresponsiveness to FSH and LHW. Withdrawal of estrogen and progesterone. E. Elevated FSH and LHR, resulting systemic changes. This hormonal imbalance affects multiple body systems, starting with the thermoregulatory center in the hypothalamus. Estrogen plays a crucial role in maintaining temperature control. When levels drop, the hypothalamus misinterprets the body's temperature as being too high, triggering sudden vasodilation of skin blood vessels, and sweating, what we know as hot flashes and night sweats. These symptoms are among the earliest and most common signs of menopause. Next, the reproductive and urinary systems begin to undergo atrophic changes due to estrogen deficiency. These changes are collectively referred to as urogenital atrophy, and they can significantly affect quality of life if not properly managed. Moving on to the skeletal system, estrogen plays a vital role in maintaining bone density by inhibiting osteoclast activity, the cells that break down bone tissue. With declining estrogen, this inhibition is lost, leading to increased bone resorption. Over time, bones become porous and fragile, resulting in osteopenia and osteoporosis. This is why postmenopausal women are at a much higher risk for fractures, especially of the hip, spine, and wrist. A useful tip for nurses and students to remember is that bone loss accelerates most rapidly within the first 5 years after menopause, making early screening and prevention essential. Estrogen also helps regulate lipid metabolism and cardiovascular health. When its levels drop, the balance between good cholesterol, HDL, and bad cholesterol, LDL, shifts unfavorably. LDL levels rise while HDL levels fall, increasing the risk of atherosclerosis, hypertension, and heart disease. This makes postmenopausal women more vulnerable to cardiovascular events than before. Lifestyle modifications, including a balanced diet, exercise, and avoiding smoking, are crucial for protection during this stage. The skin and hair are not spared either. Estrogen promotes collagen production and maintains skin elasticity. Its decline leads to thinning of the skin, dryness, and the early appearance of wrinkles. Hair may also become thinner and more brittle, while some women experience increased facial hair growth due to relative androgen dominance. These aesthetic changes can affect self-esteem and confidence, making emotional support and counseling just as important as physical care. On the neurological and psychological front, the fall in estrogen alters neurotransmitter activity in the brain, particularly serotonin and dopamine, which influence mood and cognition. Many women experience mood swings, anxiety, irritability, sleep disturbances, and even mild memory problems. In severe cases, depression can occur. Health professionals should approach these symptoms with empathy, as they can significantly impact mental well-being and relationships. Special situations include early or premature menopause, which occurs before the age of 40. This may result from genetic factors, autoimmune diseases, or surgical removal of the ovaries. In summary, the pathophysiology of menopause revolves around the gradual decline of ovarian function, leading to reduced estrogen and progesterone elevated, FSH and LH, and widespread effects across multiple organ systems, from hot flashes and bone loss to cardiovascular and emotional changes. Recognizing these patterns allows healthcare professionals to educate and support women effectively, empowering them to navigate this natural phase with awareness, confidence, and healthy lifestyle adaptations. Understanding menopause isn't just about hormones, it's about holistic care, addressing both the physical and emotional transitions that come with this stage of life.